Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Well, many years ago I had a torn meniscus, but I didn't know until maybe a few years ago. Like my knee was starting to bother me. I got
Medial or lateral?
medial.
Okay. Medial is inside meniscus. Susan is a PT, so that's why we speak different language.
And so I had an MRI.
Okay.
And a few years later, I had another one. They said it was extended into the left.
So medial and lateral.
Yeah.
Both meniscus.
Yeah.
How did you torn them?
Well, it was during a martial arts training.
Okay. So what your current symptoms?
Well, now I don't have full range of motion of my knee.
So knee extension
And flexion too, like this.
So we're gonna take the range of motion.
See, that can completely go here. This only goes.
Oh, not too
that
much.
far.
We're gonna
And I
measure
can
this.
really feel it.
For how many years?
And puffy. It's been bothering me for a couple of years now.
Okay, 2 years. So can you tell me what kind of treatment you had it on your knee?
I had physical therapy and it didn't do any good.
I'm a physical therapist.
I'm a physical therapist.
Okay, what else?
And then I do various things like I put on just like home remedy compresses and things like that.
Yeah.
And
You did not have the full range of motion yet. Do you feel pain there?
the one time I had the full range of motion was when I went to a demonstration for PEMF, and I had a treatment on my knee, and I had full range of motion when
But you had one session.
one session, and
you
lasted a couple of days.
Okay. So you might have some inflammation. Well, you did not have soft tissue release. So.
Right.
All right. So what is difficult for you to do, and how much pain, other than limited range of motion?
The pain is very infrequent, but like one night I woke up. This is really weird. Like about 4 months ago, and my knee, I was in full spasm of my entire quad. And it was so painful, and I was so delirious from it, I almost called 911. I didn't know what to do.
Yeah.
And then it calmed down, and it took me maybe a week even just to be able to walk up and down stairs. I'd have to do 2 feet in 1 step.
Wow. Are you still doing that?
No, that's much better. That was
How we aggravate your symptoms now?
Well, I work in a nursing facility, and I'm on my feet a lot, and lifting people, pushing people. So sometimes my knee feels like it's going to buckle.
Is it like if we want to aggravate, can we aggravate it with squatting or lunges or anything like that? Or you have to hold weight? How we stimulate your symptoms so this way we can see your response
Now,
to the treatment? Yeah.
how can I stimulate my symptoms? Well, I can't really balance on this leg as much.
Okay.
And the right leg is much more solid.
Okay.
So that's one thing. And then when
Any pain with that? When squatting?
No, I feel like my knee is like not stable when I'm doing this.
Okay. All
I
right.
feel like it's not stable.
But any pain or just the tightness, limited range of motion?
There's no pain right now.
Okay.
Yeah, it's so weird. It just comes and goes. And
People feel better when they see it. Just lie on your back. So we're gonna take the range of motion for flexion extension. This is gonna be in the test. You guys remember the numbers. Push your knee down. So her extension, as you see here, it's like -6 degrees. So just like 6-7 degrees. She's missing 6-7 degrees here with the extension. Okay. So let's bend it. It's almost like 132 here, but the normal is 145. She might be able to go to 150 or full measure. Where do you feel the tightness?
I feel the tightness a lot right in here. And you know, when I just bent my knee up like that, I got a whole muscle spasm all down the inside of my leg.
Will you figure, please? When you get it there, how much?
When I get it there, it's tight. It's a sharp pain, and I say it's about 5.
And when you bend your knee, where do you feel the pulling? Front, back? Where do you feel it?
I feel it right above my patella.
Above your patella, okay. Are you paying attention to the questions?
And if you notice too, on the outside of my left calf, I have a long scar from when a wrought iron fence fell on me and cut my
Lift-
leg wide open.
Okay, this one you talking
Yeah.
about? You see this? When did you have that?
That was when I was 22, a long time ago.
What happened? You said what fell on you?
Yeah, I opened the wrought iron gate and it wasn't fastened and it fell and it just split my whole leg open.
Did you fracture anything?
No, and I got a great surgeon. He sewed it up. He cut tissue out to align it really well. Look at that, beautiful. And it actually went that far. And if you see my leg,
What's happened here? This
well,
is
it was
new.
my car getting stuck
Just
in my
recent.
car.
Now?
And my leg. See, this one is straight, but this one kind of curves a little bit.
Yeah.
Here.
You see that here? Yeah.
And I don't know what
Let's
that's
focus.
from. Do you think that could be from me? I'm like crossing my legs a lot.
Could be or could be genetic. You know, that's why. Did you notice that
It could be.
when did you notice it?
Oh, I've had
Maybe
it
your
for,
bone alignment or
for many years.
yeah.
And I don't know if that's the bone that's curved or if it's from my joint.
Do you see what I'm doing? Make sure it's pain free, okay?
Yeah, that right.
I
Yeah.
found it. I lost it. Just stay tuned.
It will be fun.
Yeah.
And
Like one. It's nothing wrong with my hand. It's the scar tissue, okay? I am perfect. Not anymore. It's all in here. Let's see her calf. Okay, I'm doing the same thing on the calf, just not too bad here. Make sure you say something, okay?
okay, it's okay.
You breathing, yeah?
I'm breathing.
I will trust you too, that you're breathing, okay? I'll take your word.
Right there.
So that shows you how bad the area. So you get a feedback from the tools, the vibration, the color. So you're not gonna miss it. So it's going down, I'm doing her IT band. Okay. But if I'm gonna do it, this is actually not going with my pressure, so I'm actually clearing it to pass this one to decrease the pressure. That shows you how thick her scar in this spot. The paranoia could be a problem for a lot of patients, but you know, and where is the problem? 32?
72?
32.
32, yeah.
132
And 6.
and 6. Okay.
Negative 6.
Negative 6. Yep. Push down your heel. You guys see that? It's almost 0. Here. See that?
Yep.
See it in the camera?
Yep.
Okay. 132. Okay, you see that?
What's it at?
145.
Normal range.
Normal range. Yeah. Okay. So rub and tell me how you feel. Bend and move around. You can stand up and tell me how is that. You can stay. We'll stay here.
It's good. It's
Yeah.
good.
How's the knee?
The knee feels good.
Yeah. Yeah. You can do this. Let's see. Just move around. Yeah.
Gap is such a nice arm more.
Do it
I'll do
again.
it again.
So we try to make sure everything's fine. So what do you feel?
It's just when I settle into this,
How much from 0 to 10?
it's just like a 1.
Okay, I'll take 1.
Yeah.
So what do you think about ASTR treatment? You just experienced it on yourself now.
Well, it's the first thing that's given me any kind of relief. And it's the first thing that's enabled me to manually, to increase my range of motion. And see, the thing about the PEMF is that it may have helped with the elimination. It gave me more range of motion at that time, but it didn't change
You have
any
a
of the
scar tissue,
architecture.
you have fascia
Yeah.
restrictions.
So they need
Fascia
to
restrictions, trigger point, muscle spasm,
be, yeah.
scar tissue, you need mechanical force.
So really, without doing this, I could get all the treatments that I want, and not going to do me any good.
Yeah.
So I'm going to stick with it.
Yeah, awesome. Thank you. Thank you so much.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to ASTRinstitute.com.